Hi, this is Sean Collins, and this is Tutorial 7. Is a possibility that Tutorial 7 will extend into two separate videos, so I'm going to just preface this tutorial with the idea that it might end up being Tutorial A and B, and hopefully not Tutorial A, B, and C. So we're talking now about impairment, adaptation, and reversibility. This is really important when you're considering interventions and goals based upon this system. It basically it's the second dimension essentially. Up to this point, we've been talking one aspect of the quadrant. Up to this point, we've been really, establishing that the patient is stable at rest. We've established that they in fact have a endurance impairment. We've talked a little bit about that, and we've spent 3 or 4 tutorials now specifically discussing whether or not whether the endurance is limited due to disease-specific impairments. Now we're at this portion, this final part of the algorithm, this determination of whether impairments are reversible. And there's really two aspects to it. There's impairments that are reversible in the context of non-disease specific impairments, and then there are impairments that are reversible in the context of a disease specific impairment. Then there are impairments that are not reversible, and they are non-disease specific. Now, one thing to say about disease specific in these tutorials is that we are specifically talking about cardiopulmonary. So a non-disease specific impairment could be, it's non-disease specific related to the cardiopulmonary system. I'm just going to leave it at that. It doesn't mean that there is no disease underlying the impairment. Most of the time, when we answer no and we're looking at quadrant D, we're looking at a non-cardiopulmonary disease that is causing the impairment. Okay. So here's just an emphasis on this breakpoint where we are talking about, are the impairments reversible in two different contexts? The context of a cardiopulmonary disease-specific impairment, or a non-cardiopulmonary disease-specific impairment. So let's look at these two separately. Let's start with this one, and then we'll do this one. So number 1 is the non-cardiopulmonary disease-specific impairment. There are so many options for what this could be, it's impossible to discuss in any reasonable way through a webinar. Breaking it down, we can say that the number 1 cause of a non-cardiopulmonary disease-specific impairment that is reversible is muscle weakness. If there are, and it's reversible through strengthening. I know, this is brilliant, isn't it? Other possible reversible Non-cardiopulmonary disease-specific impairments might include reductions in range of motion, balance, and quite frankly, it would depend upon the root origin of those impairments. But they can throw off body mechanics, which increases the metabolic cost of workload and leads someone to fatigue more readily. So now I'm going to, causes of irreversible non-cardiopulmonary disease-specific impairments. Well, I'm going to say muscle weakness that is irreversible, such as that related to neurological impairments. So ALS, for example, presents a neurologically based muscle weakness that is irreversible. Patients who fall into these quadrants, let's see, now what we're talking about, non-cardiopulmonary disease specific impairments that are reversible. This is quadrant B. We can expect an increase in capacity. Because the impairment is reversible, we expect that we can increase their endurance through two mechanisms. One mechanism would be, so if this is the workload that they used to be impaired at, one way of improving that patient is that they can now sustain that workload. Another way of improving would be that they can now attain a higher workload that they maybe can't sustain for as long, or maybe they can sustain for as long. Either way, we're looking at an increased capacity, either more time at a given workload or a higher workload altogether. And whether or not which one is needed for your goals depends. That's very contextual based on the patient. So that's quadrant B. Quadrant D is a non-cardiopulmonary disease-specific impairment that is irreversible, and here we set goals specifically related to efficiency, energy conservation, increasing tolerance. So there isn't a goal to increase their capacity or to increase the length of time that they can sustain a workload. The goal might be, this is the workload they can't currently sustain and they have a irreversible cause. It might be that they are taught how to take frequent rests and do that task in pieces, but never spending too much time there and always spending enough time while resting. And people can achieve quite a lot with such interventions. Going now to the cardiopulmonary disease-specific impairments. The primary cardiopulmonary disease-specific impairments causing their endurance limitation, more likely they're going to be irreversible. So if it's heart failure, and it's due to their heart failure that they have an impairment, for example, decreased blood pressure at a workload, it is more likely to be irreversible. That is a workload that shouldn't be increasing beyond that workload or sustaining that workload for a longer period of time without regular breaks. Probably isn't a good goal. Now, there can be medical changes, meaning they might get a pacemaker that improves cardiac output by synchronizing the ventricles. They might get a better medication or better managed medically in order to allow lower fluid volume, which decreases their diastolic pressure, which then increases their pulse pressure and improves blood flow for a given workload. If anything, for this group of people, you expect slow gains, if gains are going to happen. Cardiopulmonary disease-specific impairments that are reversible are those that have obvious medical interventions that can increase their ability. So if it's not, previously I mentioned medications, I mentioned a pacemaker. Those are, in this case, I'm talking about the scenario where the individual wasn't, let's say you had someone who wasn't on a medication for whatever reason, they weren't on a medication that they now can go on. It's not just a change in their medical status. It's not just it's the introduction of a new medical procedure, I guess I would say, as the cause of the reversibility. So another possible scenario, a more likely scenario here would be a reversible condition that is exacerbating their existing condition. So whether it be heart failure or obstructive lung disease, the reversible disease of pneumonia or an upper respiratory infection, or some sort of reversible, kidney infection that increases blood volume, that decreases cardiac output. So these sorts of reversible conditions can lead to a cardiopulmonary disease-specific impairment in that they greatly impair the cardiopulmonary system's effectiveness. So pneumonia can lead to a decrease in SpO2 during activity. You then say the person has a cardiopulmonary disease-specific impairment. That is true, but the pneumonia is reversible. That is different than having a drop in oxygen saturation associated with ventilation perfusion mismatching because of dynamic hyperinflation from the fixed and irreversible problems of emphysema. So in the reasoning about this, about a case, the reversible, the acute conditions that exacerbate the cardiopulmonary condition may lead to a change in their status. So someone may test with you as having a endurance limitation due to a cardiopulmonary disease-specific impairment. They may then have a reversal of that acute exacerbatory condition like pneumonia or a URI or a kidney infection, and now they no longer test as having an endurance limitation due to a disease-specific impairment. I hope that this is more clear. If it was clear to you prior to the tutorials, excellent. I hope you didn't spend too much time listening to the tutorials. If it wasn't clear to you prior to the tutorials, then I hope the tutorials has helped. I encourage you to email me if you have questions about the tutorials, from the tutorials, if you're looking for additional information, and I will plan on seeing as many of you, hopefully all of you, at sessions that will be scheduled in Lawrence and Newburyport sometime this late winter, spring, to have a face-to-face case discussion, multiple cases discussions, to help you in the reasoning through and use of this algorithm and the quadrants. And I hope this has been helpful. Thank you.